Hello, welcome to the OAD Clinic educational program on Attention Deficit Disorder. ADHD is a lifelong neurodevelopmental condition, meaning it starts in childhood, even if it's only diagnosed later in adulthood. In our daily practice, we often see individuals who were misdiagnosed, treated for anxiety, depression, or behavioral issues, or not diagnosed at all. Many adults with ADHD weren't identified as children because their symptoms were either overlooked or mistaken for other conditions. This happens for several reasons. People with ADHD, particularly high achievers, often develop compensatory strategies such as relying on structure from strict parents or school routines. Emotional ups and downs may have been diagnosed as a mood disorder rather than recognized as part of ADHD. Coping mechanisms that worked in childhood often stop being effective when adult responsibilities increase, leading to frustration and burnout. Even in adulthood, most people don't initially seek help for ADHD itself. Instead, they come in because they feel overwhelmed by anxiety, depression, or chronic stress. ADHD-related struggles with organization, focus, or emotional regulation can lead to persistent frustration, which then contributes to secondary mental health challenges. For example, if you've had long-standing difficulties with concentration, procrastination, or time management, those may have been misattributed to depression. Likewise, excessive worrying, restlessness, and difficulty relaxing might have been labeled as generalized anxiety rather than understood as the hyperactivity or inner restlessness of ADHD. If treating anxiety or depression only brought partial relief and issues like forgetfulness, focus difficulties, or emotional swings remained, ADHD might be the missing piece of the puzzle. ADHD can present differently in adults compared to children. Some of the most common signs include chronic procrastination, which is trouble in getting started, even on tasks you enjoy. Forgetfulness, showing as losing track of time, deadlines, or commitments. Mental restlessness, feeling your brain is constantly on and hard to quiet down. Emotional sensitivity, like having strong reactions to minor frustrations or setbacks. Difficulty focusing, especially on repetitive or unstructured tasks. Impulsivity, when interrupting conversations or making quick decisions without thinking them through. Struggles with motivation, showing as cycles of high motivation followed by burnout or self-doubt. These challenges can be frustrating, but they are not a sign of laziness or lack of discipline. They're simply part of how the ADHD brain functions. If any of this resonates with you, it may be worth exploring ADHD further. Recognizing ADHD doesn't mean previous treatments were wrong. It just means we now have a clearer understanding of how your brain works. With this understanding, we can create personalized support strategies that empower you to thrive.